Have you ever walked into a pharmacy and felt overwhelmed by the endless rows of vitamins and supplements? From fish oil and vitamin D to magnesium and herbal products, it's easy to assume that if something is sold over the counter, it must be safe for everyone. But that's not always the case. As we get older, our nutritional needs change, and certain supplements may interact with prescription medications or existing health conditions. The good news is that some supplements can play a valuable role in healthy aging when they're used appropriately. The key is knowing which ones are worth discussing with your healthcare provider and understanding that supplements should be tailored to your individual needs, not simply chosen because they're popular. In today's video, we'll cover 10 supplements that many older adults should discuss with their doctor, explain why they may be helpful, and highlight important safety considerations. Be sure to stay until the end because the final supplement is one that many people take without realizing it, can interact with several common medications. 1. Vitamin D. Vitamin D is one of the most commonly discussed supplements for older adults because our bodies become less efficient at producing it from sunlight as we age. Spending less time outdoors and using sunscreen can also reduce vitamin D production. Since vitamin D helps support bone health, muscle function, and the immune system, your healthcare provider may recommend testing your levels if a deficiency is suspected. While supplementation may be appropriate for some people, taking high doses without guidance isn't recommended. Too much vitamin D can lead to excessive calcium levels and other health problems, which is why it's best to discuss the right dose for your individual needs. 2. Vitamin B12. Vitamin B12 plays an essential role in healthy nerves, red blood cell production, and brain function. Older adults are at increased risk of deficiency because the body often becomes less efficient at absorbing vitamin B12 with age. Certain medications, including some acid-reducing drugs and the diabetes medication metformin, may also affect B12 absorption. If you've been experiencing fatigue, numbness, balance problems, or memory changes, your healthcare provider may recommend checking your vitamin B12 level. If a deficiency is confirmed, supplementation or injections may be appropriate depending on the underlying cause. 3. Calcium. Calcium is well known for supporting strong bones, but not everyone needs a calcium supplement. Many people are able to meet their calcium needs through foods such as dairy products, fortified plant-based beverages, leafy green vegetables, and certain fish. Taking more calcium than necessary may increase the risk of kidney stones in some individuals. Before starting a calcium supplement, it's worth reviewing your diet with your healthcare provider or a registered dietitian to determine whether you're already getting enough from food. 4. Omega-3 fish oil. Omega-3 fatty acids found in fish oil have been widely studied for their role in heart health. Some people may benefit from increasing omega-3 intake through foods such as salmon, sardines, trout, or mackerel. Fish oil supplements may also be appropriate in certain situations. However, fish oil can interact with blood-thinning medications and may increase bleeding risk in some individuals. That's why it's important to discuss any omega-3 supplements with your healthcare provider before adding them to your routine. 5. Magnesium. Magnesium is involved in hundreds of processes throughout the body, including muscle function, nerve signaling, and maintaining a normal heartbeat. Some older adults may have low magnesium levels because of certain medications or medical conditions. Although magnesium supplements can be helpful in some situations, they aren't appropriate for everyone, particularly people with certain kidney conditions. Different forms of magnesium also have different effects, so choosing the right type is another reason to seek professional guidance. 6. Probiotics. Probiotics are live microorganisms that may help support digestive health for some people. They are commonly used after certain antibiotic treatments or to help manage specific digestive issues. While many people tolerate probiotics well, not everyone needs them, and the benefits can vary depending on the specific strain and the reason they're being taken. Instead of assuming every probiotic works the same way, ask your healthcare provider whether one is appropriate for your situation and which type may be most suitable. 7. Iron. Iron supplements are often marketed as energy boosters, but they should never be taken routinely unless recommended by a healthcare provider. Iron deficiency can certainly cause fatigue, but taking iron when you don't need it may cause side effects such as constipation and stomach discomfort, and excessive iron can become harmful over time. If you're feeling unusually tired, it's much better to determine the underlying cause through proper evaluation rather than assuming iron is the answer. 8. Coenzyme Q10. Coenzyme Q10, often called CoQ10, is a naturally occurring substance involved in energy production within cells. Some people take it because they're interested in supporting heart health or because they experience muscle symptoms while taking certain cholesterol-lowering medications. Although research is ongoing, CoQ10 may be helpful for some individuals but isn't recommended for everyone. Since it can interact with certain medications, including some blood thinners, it's another supplement worth discussing before starting. 9. Herbal Supplements. Products such as ginkgo biloba, turmeric, garlic supplements, ginseng, St. John's wort, and others are often promoted for memory, joint health, or overall wellness. While some herbal products have been studied more than others, they can also interact with prescription medications or affect blood clotting, blood pressure, and other medical conditions. Just because something is labeled natural doesn't automatically mean it's safe. Always tell your healthcare provider about every herbal product you're taking, even if you purchased it without a prescription. 10. Multivitamins. Many older adults take a daily multivitamin as nutritional insurance, but not everyone needs one. A balanced diet remains the best source of vitamins and minerals, and some multivitamins may provide nutrients you already receive in adequate amounts. Others may contain ingredients that aren't appropriate for people with certain medical conditions. Rather than choosing a multivitamin based on advertising or popularity, ask your healthcare provider whether one fits your individual nutritional needs or whether a specific nutrient would be more appropriate. Conclusion. Supplements can be helpful when they're chosen for the right reasons, but they should never replace a balanced diet, regular exercise, quality sleep, and routine medical care. Vitamin D, vitamin B12, calcium, omega-3 fish oil, magnesium, probiotics, iron, CoQ10, herbal supplements, and multivitamins may all have a role for some older adults, but the right choice depends on your health, medications, and nutritional needs. Before starting any new supplement, make a list of everything you currently take, including vitamins, minerals, herbal products, and prescription medications, and review it with your healthcare provider or pharmacist. This simple step can help reduce the risk of unnecessary supplements, unwanted side effects, and potentially harmful interactions. If you found this video helpful, please give it a thumbs up and subscribe for more evidence-based health information designed especially for adults over 60. Share this video with a friend or family member who takes supplements regularly. They may learn something valuable. Thank you for watching, and we'll see you in the next video.